Hello everyone, my name is Colleen Bartlett. I am an APRN at the Chronic Complex Clinic at St. Joseph's Children's Hospital in Tampa, Florida. I see children with multiple medical problems, and something that has caught my interest lately is virtual reality in healthcare. Many of the children I take care of have congenital heart disease and neurosurgical problems, and those teams recently started using virtual reality for surgical planning in my hospital. So virtual reality, what is it? Virtual reality is artificial reality images that are created with three-dimensional graphics by using information technology that allows the user to interact with the simulation directly. Virtual reality is an emerging technology that's being used in different fields of medicine. It was termed so in 1986 by Jaron Lanier, who was a computer scientist. Before the term virtual reality, the term artificial reality was suggested by another computer scientist, Myron Kruger, in 1969. Kruger created the first virtual reality system where a stereoscopic image was projected onto the floor of a cubic room in 1992, and he is considered the pioneer of virtual reality. Virtual reality was first started being used in healthcare in the 1990s to plan surgical treatment and visualize complex data. In 2009, the International Society for Virtual Rehabilitation was established to create common ground between engineers, scientists, and clinicians who wanted to introduce these new technologies in motor, psychological, cognitive, and social rehabilitation. Virtual reality continues to emerge in different healthcare settings, and it is currently being used for teaching and training, surgical planning, virtual endoscopy, psychology, recovery, and telemedicine. So there are many ways that virtual reality can improve patient care. One is through care coordination. So care coordination is used in integrated multidisciplinary care to deliver personalized care plan with all team members involved in a patient's care. An interdisciplinary team for care coordination is a group of providers from different fields that work together to give the best care and outcomes to a patient. Virtual reality can improve care coordination by involving the care team in treatment. The unit can include a cardiovascular surgeon, a primary physician, nurses, therapists, patients, and their families. The teams work together based on the patient's diagnosis and form individualized care plans. The team can all take part in surgical planning discussions about future care and provide training if needed for the family. So patient safety. Patient safety is of the utmost importance to all healthcare providers and organizations. When virtual reality is used for procedural and surgical training, educators can stray away from traditional teaching methods. Inexperienced healthcare professionals will not need to use cadavers or animals for teaching purposes as they have in the past. Virtual reality provides alternative and safer training methods using patient-specific models. Virtual reality-based teaching protocols and training can lessen the chance of medical errors and enhance learning. In the past, medical errors have been made due to mistakes in performance and inexperience in procedures. Virtual reality can help close this gap to prevent mistakes and improve patient safety. Quality improvement. Virtual reality is being used to improve quality across healthcare. Quality improvement is used as a formal approach to analyze practice performance and improve performance. It has been widely researched that virtual reality can improve outcomes and training for procedures versus regular training. One study evaluated the effectiveness of virtual reality simulator training versus box trainer training for learning outcomes in minimally invasive surgical techniques. The findings were measured using the time to perform surgery and performance score. The results proved that virtual reality simulation training were more efficient than box trainer training when evaluating the time needed to complete surgery and the performance score. Also in the past, robotic cardiac surgery training was done using classic teaching methods. One study sought to evaluate the virtual reality simulation curriculum and added it into traditional techniques to improve cardiac surgical skills. 20 surgical trainees underwent a 9-exercise virtual reality simulation on robotic surgery, while a control group received no additional training. The trainees were then evaluated on standardized robotic internal thoracic artery harvest and mitral valve annuloplasty using a validated time-based scoring system and tool. The virtual reality group trainees were faster than the control for both interventions and scored higher using the interoperative scoring tool. The virtual reality group also achieved high proficiency levels similar to that of experts for both surgeries. This study proved improved quality and could be reproduced when using virtual reality education curriculums for surgical trainees and improve patient safety and quality. Cost containment. So the virtual reality market is estimated to be at $108 billion by 2021. Right now, virtual reality headsets and lower models can be anywhere from the high hundreds to high thousands of dollars, but a virtual reality medical grade simulator that are being used in educational organizations and hospitals are upwards of $100,000. The cost of these systems are high, but the worth is invaluable due to the health benefits the patients received and the improvement in patient safety. Total health costs could be decreased as the studies above showed better surgical outcomes and in turn can prevent prolonged hospitalizations or surgical procedures. So patient engagement. Virtual reality for patient engagement is done in a variety of ways. Patient engagement is essential for the proper management of one's care. Patients that are included and engaged show positive participation in their health. For surgical procedures, patient engagement is achieved by allowing the patient and family to walk through their anatomy and teach them about their diagnosis in a way that they can understand. Patients and families can experience the surgical procedure they are preparing for and have confidence moving forward. That gives patients positive participation in their care, autonomy, and confidence in their surgeries and their own health. With any new technology, there are pros and cons that need to be considered. Research has showed multiple pros of virtual reality used in medicine, some of which we've already talked about. The first is enhanced training methods for surgery and surgical planning. Virtual reality surgical simulators provide a standardized ways for trainees to be educated on surgical techniques, and the results are reproducible. The training can take place in controlled environments, and the advanced technology can help bridge the gap from learning in a protected environment and taking those skills into the operating room to increase patient safety and enhance their skills. The second pro is associated with virtual reality use to decrease pain. Oftentimes, patients that undergo surgical procedures experience different levels of pain. Virtual reality is being used to treat children and adults after surgery to reduce their pain. Virtual reality can cause distraction, which decreases pain, and it also causes self-regulation of pain. The research shows positive results with virtual reality intervention to manage acute surgical pain, but more studies need to be done to really support the use of virtual reality for chronic pain. The last pro that I'm going to discuss is how depression and anxiety are common ailments for people with congenital heart disease and other chronic diseases. Virtual reality interventions have been tested, used alone and in combination with other psychological interventions. The study showed that their use of virtual reality in patients with depression did show improvement in overall anxiety and depression using post-test and follow-ups. Some hospitals and outpatient psychiatric facilities are already implementing the use of virtual reality and augmented reality in their interventions to treat psychological conditions. The cons. There's always some limitations with new emerging technology as well. The first for this is cost. The cost of the virtual reality systems in medicine and education. The expenses that are incurred with a virtual reality system include costs for system hardware, laboratory costs, and space, as well as wages for technicians and training for simulations. The costs associated with virtual reality simulations will be placed on the teaching institutions, hospitals, organizations, institutions, and trainees using the virtual reality, as well as the patients could incur higher medical costs. Organizations and educational institutions that cannot afford these new technologies will be considered out of date in upcoming years. Another limitation of virtual reality simulation in education and other classroom experiences is a lack of flexibility. In the current classroom setting, students are flexible and open to conversations, asking questions, and making suggestions. With virtual reality, this is not possible as you're using a headset and simulations independently. There's a lack of flexibility, which can affect the way some students learn and engage. Lastly, there is a disadvantage of interpersonal connections with virtual reality. As mentioned previously, virtual reality is different than conventional education. Interpersonal relationships often aid in education and human communication. Virtual reality is different in that it is used individually. While surgeons can involve family and friends in virtual reality and surgical planning, there is a lack of overall human communication. By using virtual reality, some trainees might lack vital components of medical care. Ethical legal concerns that can arise with virtual reality are issues with privacy, consent, and access. As technology continues to increase, there's always a risk for breached privacy. In the future, there is concern that kinetic fingerprints can emerge and individual online movement will be tracked and exploited by predators. Another ethical concern is desensitization. When trainees use virtual reality regularly to learn surgical and other procedures, they can become desensitized to the technology, and this can lead to errors. Lastly, an ethical and potential legal concern is accessibility with virtual reality education. If virtual reality becomes the preferred education method in the future, there will be talks about accessibility for all users. It is crucial that practitioners follow current laws in place for patient safety as well and ensure their privacy be maintained. With any emerging technology, there are barriers that can prevent future development. Current research is aiming toward increased virtual reality use in medicine in the upcoming years. The most significant barriers virtual reality development will face are standardization use in education and surgical training, acceptance throughout healthcare organizations and educational institutions, technical obstacles that may arise, and cross-related issues. All of these potential barriers should not deter future progression of the use of virtual reality in medicine. In conclusion, virtual reality is being used in many facets of healthcare successfully. It is proven to be effective in surgical planning, education, improving patient safety, managing acute pain, improving patient psychological state, and overall patient health. The barriers of virtual reality cost and acceptance are outweighed by the positive benefits of health. Healthcare practitioners and educators must become aware of new advancing technologies to find the best ways to improve patient care. Virtual reality will continue to advance healthcare in the next few years and continue to improve the patient experience, safety, and overall health. I personally have learned a lot doing this project about virtual reality and emerging technologies, and I hope to continue to learn more about them in the future. Thank you, and here are my references. Bye.